We're going to get started. It's a minute after 10, and if folks are going to join afterwards, that's fine because we will be recording the session. So hopefully everybody can see us on camera. Welcome to the session live from Philadelphia. Colleen, can you tell me if the sound's okay on the line?
I hear everything fine, and I don't hear any echoes or other noise.
Perfect. Okay. And for anyone who's coming on, if you're coming onto the WebEx session, if you could mute your line, just that way we won't hear any background noise. And for coming onto the conference call as well, if you could mute yourselves, that'd be wonderful. We'll hurry towards the end where we'll open it up and folks can ask questions. Also, during the presentation, you could use the chat box to provide or to write in any questions that you may have during the presentation. So we'll stop. I'd like to introduce our team here in Philadelphia at Temple University. My name is Jennifer Ibrahim. I'm the PI on this project, the principal investigator. I'm the associate professor in the Department of Public Health in the College of Public Health.
I'm Liz Platt. I'm a senior legal researcher for public health law research.
Actually, I am a manager at Public Health Law Research.
And I am Lindsay Foster. I'm a senior manager with Public Health Law Research.
And we're extremely excited today to share this project with you. This is something that we've been working on for the last probably year and a half, 2 years, been in the hopper. And I really like to make sure that I acknowledge both Dr. Schaefer and Dr. Acierno. We started sketching out this project with Dr. Schaefer about 2 years ago. And once we put the project together and applied for funding, Dr. Acierno was a huge proponent of it. It really meant a lot being able to get that support. So we've named the project Building Access and Understanding of Law and Public Health Practice in Nebraska. And hopefully as we walk through this, you'll see what we're trying to do in this project. All the folks here, the Temple team, there are a couple of other individuals that have been helping us working on coding of the laws. So I want to make sure I also acknowledge Sterling Johnson, Kelly Thompson, and Annette Hooper, and Sarah Happy from our team here at Temple. And Colleen and Daryl, if you want to introduce yourselves.
You go first.
This is Colleen Swoboda, the Nebraska Division of Public Health. We're very excited to partner with Temple on this project. I've been just helping with grant coordination and those kinds of activities. So I'm excited to be part of the team. Daryl.
I'm fine. I'm an attorney assigned to support public health here at the state of Nebraska, and I think what Jennifer and her team are doing at Temple is the cutting edge in terms of what the youngsters are doing nowadays instead of the dusty old books, and a great way to promote and familiarize practitioners with public health law. So go guys.
Great. And I want to acknowledge that support for this project was funded by the Center for Public Health Services and Systems Research at the University of Kentucky. So, a situation where you need to access the law. I think quite often the pictures that are popping up on the screen is something that you experience, range from confusion all the way up to sort of complete bewilderment and frustration of where do I go to access the laws. And then if you are able to access laws, being able to comb through many of the lawyers on the phone, I mean this with the greatest sincerity, but for many folks it comes across as legal mumbo jumbo. How do you take that and break it down into something that will help you understand the scope of authority that you have to act? What are the powers that you have to do your job in terms of delivering essential public health services? Even it may be difficult to access the law at times. We know that the law is something that is routinely used in public health practice. And there's just a couple examples I throw up here, but while you may not consciously think about it on a daily basis, law is prevalent in everything that we do in public health practice, ranging from sanitation, restaurant inspections, thinking about major instances such as the Ebola situations that we had over the last few months, look issues of quarantine and balancing the public with individual liberty. A major issue we're seeing on the I see a couple people saying that we're having some background noise. Give me just 1 second and I'll remute the line. Okay, there, hopefully that cuts down on the noise. The vaccine issue that we're seeing, you know, the measles outbreak that started in Disneyland in California and has spread across a number of states, and then even things looking at prescription drug monitoring, a major issue that we see in public health practice. And there are also many more. This is just a snapshot of the public law being present and right in the forefront with public health practice. Overview of what we were trying to accomplish with this project, we wanted to go through and sort of a test case to see, is it possible to go and collect all the laws that govern local authority to act in an individual state and be able to put them in an online interactive system, which we're going to show you today. It makes it easier for anyone to access it, be it public health practitioners, be it lawyers, be it researchers, being able to conduct evaluations, the idea being we're doing everything we can to move law from being this confusing, magical, mystical thing to something that is very readily accessible and everyone can use. So aim 1 and aim 2, and that's what we've been working on over the last year. Another piece that we'll be rolling out very shortly with the release of this site, we're also going to be sending out to everyone a brief survey asking you about your perceptions of law and the use of law in routine practice. Being able to look and see by having this tool available to you, how has this changed both your perception and routine use of law in public health practice. I'll get that towards the end. Finally, you know, being able to demonstrate that this is a tool that could be useful, probably systematically and empirically evaluating the effect of a law or individual provisions within a law. For example, we talk about the clean indoor air law. It's just no smoking indoors. It's looking at, with a much closer, finer grained look at, you know, what are the exemptions, what are the fines, what are the penalties, really thinking through that if we're making modifications to law, what does that impact have on performance, what does it have in terms of behavior change for the population, what it means for changes in population health. So this is really a huge project, and again, kudos to Colleen and to Daryl that we started talking about this. It really felt a lot like pie in the sky, and there were a number of people who said, you can try it, good luck, it's probably not happen. And like I said, we're all very excited to be able to share this with you today and say, it did happen, and we're looking forward to getting your feedback on how the system works. Essentially what we did is, this grant was funded in October of 2013. And we started working, talking with Daryl, and at that point there was also a legal attorney who was working with Daryl, and we started to talk about what is the scope of the law that we want to look at. Being able to say we're going to look at all the laws that govern public health practice mean different things depending on who you're talking to. And so we worked through to come up with a common understanding of exactly what we were covering. And you'll see some of that coming out when we show you the system. Then what we did, we worked with Daryl and his legal intern to be able to collect text of all laws within the scope that we dictated. Once those laws were collected, they were via, as Daryl would put it, the fancy internet. They were shipped over to us at Temple, and that's when we started working with them to take them from what you see on the screen right now, individual provisions and text of the law, and actually convert them into what you will see in the online system in just a moment. Went through and do that transformation from text of law to something that's much more accessible. We're doing that by looking at coming up with particular questions so we can pick the meat, the bones of the law, and we can be able to digest all the information in that system. And so what you'll see on the screen here is just an example of some of the questions that we were using to pull out. So this is looking at the Nebraska Clean Indoor Air Act. We said, what are the different things that we want to be looking at? Where the place of employment is, are there restrictions in public places? We came up with all the individual questions. So we have coders here at Temple that sat with our online system, which we call Workbench, which is embedded in the LawAtlas system. And again, we'll show you that. They got with the workbench, with the text of law, use those questions that the community here created, and then being able to answer those questions, which were then transformed into the online data. In addition to what you will see today, we're also working, we'll show today all the state level data, and we're also working on coming up with similar parallel system that will collect and code all of the local public health laws, and then for the two major cities. I'm trying to be able to look at all the laws across the different jurisdictional levels. So something that will be coming soon later on this spring. And part of what we want to do is to receive feedback from folks using the system to be able to talk about how it works. They wish it was easier to use. Oh, and people saying, let me just mute. Hopefully that helps cut down on background noise. Also, that we can integrate feedback in real time as you're telling us it would be easier to do this, that, or the other. So, we started out a year ago. I tell you enough, looking at the scope of laws, with the volume of information that we've had to process through, we really hope that this is something that is useful for folks. Here is, I'm just trying to get some other stuff out of the way. What you see here is the body of law that's covered. There are a number of what we would call different legal data sets. These are the bins or the buckets that you will see on the system. The idea being that this starts to hone down if you're looking for laws related to a particular topic area. You can click on these areas. And we had come up with a taxonomy that, from an academic perspective, seemed great, seemed fine. In working with Daryl, what we wanted to do, and with Colleen, what we wanted to do was actually think about what the terms, what's the language that's used most commonly in Nebraska, because we know if we move from any state to another or even to local jurisdictions, the language and the terminology that different folks use were potato, but if you're looking for potato and you're searching and you're seeing something that says potato, it may take a little bit longer to get you where you want to be. And so it was very important that we worked with folks in Nebraska to make sure that we were trying to come up with the terminology that's consistent with what you're used to seeing. Again, we're open to seeing revisions over the course of time at your suggestions. So without further ado, I will shift over, and Elizabeth is going to walk us through the actual data set. So bear with me for just a moment as we shift over.
All right, so I'm going to walk you through navigating our website. So as you see this screen here, this is our homepage at lawatlas.org/Nebraska. And these 12 links listed here are the 12 major public health topics within our scope, the buckets that Jen was referring to that we saw in the previous slide. And to demonstrate the functions of this site, I'm going to use health professions as an example. Link here. And you see this is a list of all the health professions that we covered under this topic. The text up here gives us a brief background of what is encompassed within the health profession topic. And each of these represents an individual data set with similar questions. We decided to use similar questions so that we could compare all of the health professions involved against each other, as you'll see. And so to show you this, I'm going to just choose optometrist. This is what the individual data set pages will look like. So as you see here, this is the optometrist. This is our landing text. This is going to provide a quick definition from Nebraska law of optometrist. And then it says that this page has been updated to include laws that are currently in effect. And we're going to kind of go against the blue button, and I'm actually going to start with the table. This is showing you all of the data that we collected in question formats over here on the left. So these are all the questions that we asked, and these are the responses and the answer choices we found in the Nebraska law. So this is the effective date. So all the law, this is the most recent amendment to the law, and it said that was our valid through date. Over, if you click View Law, this screen shows you all of the law within the scope for optometrists that we use to answer this question. And so you see there's a lot of statutes and regulations. If you would like to get this in PDF version, you can click this icon here. So, coming out of that. I said the questions. You'll see that this is a main question. We refer to this as a parent question, and underneath you're going to have more specific indented questions. These are child questions that just get down to more specificity of what we're asking about. And other things to point out over here, you have our responses. So we're saying that what are the requirements to issue a license? These are responses that we found in the law. Then is this little blue icon here, that section symbol. And it's going to pull up the individual statute and regulation or whatever source we found that answer from. And if you click the link, it's going to put the law behind it. It will take you to the which is highlighted. So that you get to that data. The other thing to point out, occasionally throughout the data, you'll see these little red triangles. These are caution notes. We use these to explain a specific feature of the law that we think maybe we should expand upon to explain something unique in this particular response. You'll see these periodically throughout. It's just to, like I said, point out something specific. So in this case, this caution note is just explaining that if you do need a degree, and here's the specific degree that you need to state. Other data tools we want to point out, over here on the left for research purposes, if you wanted to download statistical data, this will download an Excel spreadsheet with the statistical data that you can use for analysis. This is our code book. This is going to list out all the variables that we use while coding. Click on that. And see, this is the code book for optometrists. And you can see it's going to list out all the variable values in the question. As our protocol, this explains the background of our process, what we use for this specific bucket for health professions. Through our scope, our collection methods, and it's going to lay out some of the coding decisions that we made across the board to keep everything consistent within this topic. The individual page, and ironically, I'm going to click on the Start Here button now. This is going to display all of the questions that you saw in the table below. And this is a way that you can use all the possible answer choices so you can compare across jurisdictions, across the health professions to see which health profession has what requirement or what duration of license validity, and compare that way. For instance, if you wanted to see if there was a professional exam requirement here, you click on that and it's going to show you that yes, they found a jurisdiction, which would obviously be the optometrist here for professional exams. So that's how that would display if it was a positive response. For instance, you wanted to see if there was a continuing clinical requirement, you clear it and this would come up as 0. So no, this particular profession doesn't have a continuing clinical practice requirement. That's what the individual pages look like. And you'll see that was just health professions. If we were to go in, we were mentioning Clean Indoor Air Act before, that's under this topic, and it's going to look similar. It'll have different questions tailored to that particular topic, but it'll have the same responses, the sections, and this one would look like that. And the thing I wanted to show, this is where our public health laws will live as we're working on that currently. So, that's the plan.
I think the other thing, it's important to mention that this is sort of the first reveal. We want to get this out there and have folks start using it. One thing that we are working with the folks at the the State Department of Health is actually to, within topic areas, be able to provide additional information in the white space here that we may be linking to other data sets that are related to the laws that we're talking about. or programs or any other resources that would be helpful. If we're talking about a requirement to complete a particular form, we might be able to have a link to that form in there. I think that's going to make this more user-friendly, and so, you know, I emphasize enough that as you're going through and using the system, providing feedback, and we can add an email address on here. I'll just have a new temple address, that you can actually be able to provide feedback for us, so that it becomes really a learning process from both sides. That the more you're using it, the more we're learning about ways to make the system more useful for you. While what Lizzie was just showing in terms of the data piece of it, without Thomas Trust, being able to access the data here and the code book and the protocol, this is something that would be important for researchers who wanted to be able to use these legal data sets to do an evaluation of a particular law, or looking at the effect of a particular provision on behavior change or performance. So we really see the system, and it was set out to be multifunctional, that there are opportunities for it being a more academic exercise, and there are opportunities for, if you're in a particular situation, and you know, am I allowed to do this, or I'm not really familiar with this, or what's the legal authority for so-and-so to do something, the way that hopefully you can very quickly and easily, if the question you have would fit into one of these topic areas, you could click real quick, look through and see, instead of having to scroll through all the different questions, you could see really quickly the different areas here. So we're hoping that it's something that's interesting. We feel that it's innovative. Oops, very quickly. And with that, we will open the lines up for questions. Let me just look really quick to see in the chat if we have any questions that have come in. Nope, no questions yet. So I'll open it up. If folks want to ask questions over the telephone line, or folks want to send in any questions they have on the chat, got it open and are happy to answer any questions. And just to any of you, if your lines are muted, just remember, unmute them before you go ask a question. If we're recording this, and yes, we are, I will, once this is over, I'll send the entire recording along with just the individual slides that you saw. We'll send those to Colleen and Daryl, and then they'll be sent out via the same listserv where you got the invitation. When does this go live? It goes live as of today, and I realize, and I'll change this on the slides before I send them out, it's really important for you to have the URL to know where to go. The URL, you can see it up at the top of your screen here. It's http://www.lawatlas.org/Nebraska. Currently, anyone could go in and access this, but it is not part of, and I'll click over for just, we have a larger website, which if you were looking for data on any other topic areas, this is the larger LawAtlas data set that we have. And what these data sets are comparisons, for the most part, across states. If you wanted to look at Good Samaritan overdose prevention laws, you could go in and look at across all 50 states and over time, those. The Nebraska site that we've created for now is only accessible to somebody who knows this URL. The idea is we want to be able to work with the folks just in Nebraska and get it to a point that you find useful and helpful. I also want to make sure if there were any errors in any of the data sets that we're correcting them, so that we're as accurate as possible in what we're reporting. So it's www.lawatlas.org/Nebraska. That's Nebraska with a lowercase s. Nebraska, the first state to do this. Yes, Nebraska is. Part of the reason for that is there was another study that I was working on a couple years back that Dr. Schaefer had participated in, where we were trying to assess the degree to which state health officials and public health attorneys were working collaboratively together. And so through that process, I had the opportunity to start talking with Dr. Schaefer and to talk with Daryl, and I was just really taken with how engaged Nebraska was with public health law, and that's when we started talking and said it would be great to try to do this project with Nebraska. So Nebraska is the first. I think part of our hope is that if as well, this could be something that we could then share with other states who are interested in doing something similar, and that would give you the functionality when Liz was showing you opportunities to compare across jurisdictions. With system, you'll be able to compare state and local jurisdictions. If and as we expand to other states, you would then be able to compare your laws to other state jurisdictions. How long have you been working on getting Nebraska information into the system? So we started working on this project in October of 2013. It took a couple months to deal with some of the administrative stuff. We actively were building the infrastructure for this. We actively were rolling in summer of 2014, and we've had this pretty much set. The data sets have been live since about holidays, December holidays, so 6 months. Some of it has been a learning curve to figure out what's the best way to do this. Now, at the state level, which we have more experience in, but making sure that we're able to translate the questions that we're asking here at the state level potentially to the local level data. We're anticipating, as I said, hopefully later this spring is when that coming soon link for local laws will change to live local laws. Can you talk a little bit more about how this will be updated and maintained as new laws come online? So the way this grant was structured was that we would do the initial getting everything live and set up. I think if, pardon me, if this works and people find it helpful and useful, it's going to become a conversation that we need to figure out a process for keeping it up to date. You always see in anything that you click on, the law was up to date as of such and such a time period. Is this something that's beneficial? That's a conversation that we'll start to have with the State Department of Health. It'd be that difficult for us to be able to train folks there to show them how we were doing this. It could be the type of project that we hand over to the folks in Nebraska to be able to do those updates. But I think update is, I'm glad someone asked that question. Thank you, Susan. That's an important element. Are states that have a system like this? Nope, not yet. Hoping that that will change over the course of time. Let's see. Post information on upcoming laws. So whoever asked that question, if you could just provide a little bit more text. Typically, the only thing that you would see here would be laws that were enacted. We're not tracking bills in the legislature, so it would be a matter of once a law was passed, that's when it would be. That's when you would see it showing up in the system. Another question: what do you envision will be the top few ways that local public health will be using this LawAtlas? And equally, will it be updated? So. And a bit speculative, but the question also said, could it be yearly after legislative sessions? And when it would make the most sense to be doing updating is at the end of a legislative session. And we've inventoried all of the laws and it took about 6 months with a team of coders. Doing updates wouldn't be as difficult because the structure is already here and you're updating a limited number of laws. But what do you... the difficulty doing updates?
I mean, we have a process to actually track law regulations that are in process. Oftentimes, I think with the legislative session is, like I said, a pretty clean break, so it's a lot easier to just essentially site check the different laws and regulations that may not have changed. Sometimes sometimes it's just a matter of checking the new effective date at the bottom of the session law and seeing if any movement has been made. One of the philosophical elements and oftentimes problems with policy surveillance is that we observe the immutable characteristics of the law as they may or may not change. So even law gets, a new bill is passed and some simple periods have been removed or commas have been edited or something like that, we typically will try to include that as well. So it can be somewhat labor intensive. So we may have to develop a new process whereby we actually sort of make some judgment call or interpretation on the substance of the law and the elements that change therein, that we don't compare our normal process and create too much work. That is a discussion that we definitely have, especially because this is a new experience for us and how the normal process has been morphed in a lot of ways.
Mm-hmm.
So.
This is Daryl from the state. I don't know if you can hear me.
Yeah.
Jen.
Yep, we hear you.
Okay. We track at Health and Human Services. We do track the bills, so we'll know which of the that we're responsible to administer have changed, and either identify those for whoever's responsible for the update, whether it's internal or not. And of course, we know when we get our regulation, generally go as a set. So just it would be one particular subject matter area at a time. So we are of that. So the capability to do that should be difficult to be able to identify. And I'm committing. I mean, I am not in a position to commit somebody to do that, but it fits what we already do. We're already tracking bills. We're responsible for promulgating our regulations. The public health laws here, some public health laws aren't necessarily going administered by the Division of Public Health or even by DHHS, because there are public health laws in some instances that are basically enforced through criminal sanctions. There might be some outliers that would be a little more difficult to track, but the bulk would fit in with what we do normally.
This is Colleen. I heard part of that question was how do you anticipate local health departments using this, or what they use the most. And I can say that I know you're going through the accreditation process, and we are too. And I have had to dig into the law several times, and it's hard to find things. I'm getting better. But I think this would make it easier to access those laws, so that I'm looking for information on communicable disease or foodborne illness. Who does that? What does that look like in our state? This will be an easy way to do that. And once local laws are added, it will be a good place, an easy place for you to find things. And how that's for you right now, but if it's a place like this on the web, I think it's easier to access.
One of the other things too, that as we were doing this and we've been taking notes, there are places where there are inconsistencies or areas where the law is considerably older and there's a need for updating. And so I think the tool in itself could also be used for looking at the state of law in a particular area, and folks may not be aware of some of the provisions that are currently in place. And so it might also help to set an agenda for policy making moving forward. Other things that we want to go back and revisit and then be able to move forward on making amendments to the existing law. Let's see. So,
the things, things that Jennifer's talking about is, and I've discussed this in some of my other and job duties, but for instance, we have some sets of regulations that use the commonly accepted terminology in a particular area, and yet the statute that underpins those regulations uses outdated references. And I'm going to use one that doesn't apply, but a lot of people think of the word idiot as just being a pejorative, but that used to be a scientific term that was used to apply to certain individuals. So anyway, we've got some laws that use some terminology that many people might consider to be offensive. And so one kind of anticipated thing that might come from looking at these laws is just generally making people aware of what the terminology is. It might lead to some updating. I answer a question that Jennifer did a little earlier about upcoming laws. While my understanding of what LawAtlas does per se wouldn't do that, it kind of has that effect if you look at not the Nebraska site, but if you look at their LawAtlas in general, you might see areas that a number of other states have a particular covered, and states don't. And one of the on the screen right there, medical marijuana. For instance, you could look at the states that do have those things and compare it to the states that don't. So you can kind of see trends that are likely to occur by looking at what other states have done. And that would be at their main LawAtlas site.
And what I'm just showing here is just a snippet of if you go and click and you say, I want to answer the question of which states authorize use of medical marijuana, then what you see here on that is the different states. You could click on a particular state and you'll get the information just like you'll see in the Nebraska specific site. You'll see the same format and structure that you can go through and see answers to individual questions. The information that we've collected at the state level with Nebraska, instances where that maps with the data sets that are currently up here, the Nebraska data is already part of those, and that helps to pull over into the Nebraska only site as well. One of the questions that came up was about the scope of local laws. So what we have scoped out to do at the level is the county laws and Lincoln and Omaha being the largest cities. What we mapped out in the context of the grant, it doesn't mean that over the course of time that could be expanded to look at other local laws, but currently in the scope of this grant, which will end in September of this year, 2015, this is how far that we'll get with it. But I think, again, having the infrastructure hopefully is something that is useful and it continues once the grant is over. But that is going to be contingent on the feedback we get from folks. Say, is this worthwhile? Is this useful? And here are ways that I'd like to see modified. This in the mix talking about the use of this at the local level, where this idea came from. The study that I was talking to about, I started having the conversation, I guess it was 2 or 3 years ago with Daryl and Dr. Schaefer. It really looked at the state level and it also looked at the local level. And one of the big challenges in the random sample of local jurisdictions across the U.S., those individuals that I spoke with, there were 2 key things that came out. A lot of folks thought of law solely as litigation and being sued for doing something incorrect. And so there was very much a number of people of perception that law was a nuisance. And it was sort of a necessary evil that was around, as opposed to thinking of it as a tool that could proactively be used to help deliver public health services better. The other across these interviews was that at the local level, a lot of folks don't have a public health lawyer the way that might be structured at the state level. And so if you're going to ask a question about the law, many of the local jurisdictions contract with a local attorney, and every time there's a question that's being asked, there's a fee associated with it. There was some way that public health practitioners could delve into the law and it's more accessible for them. That might help them, as was reflected in state conversations too. This would be a way to have public health practitioners and lawyers start to have a similar language to talk about public health issues. Not that we're trying to get public health practitioners to be lawyers, and we're trying to get public health lawyers to be public health practitioners, but it would be a lot easier to engage in conversation and tackle issues proactively instead of having to put out fires if there's a common understanding. And Daryl, if you want to comment on that too, because I know that's something that we talked about with
I'll briefly share our areas, and I'm only not going to speak now with my experience, so this doesn't necessarily apply to local public health departments. But there are areas of what we consider public health in Nebraska where, due to the nature of the job, the practitioner would have done it willfully on their own or not, is immersed in the law and understands it. We'll have people that are actually responsible for answering calls from the public what the requirements are for a particular regulated area. These folks are kind of experts in the law, and there are other in the kind of the regulatory portions where we have an active role in being kind of a police function. But in other areas of public health law that pertain to the aspects promotion and raising public awareness of best practices, some of the folks, a grant in existence actually has law behind it, but folks aren't necessarily required to get into those things. So there are vast areas where folks are doing grant work where they haven't had the need to understand what the law is. And so, you know, for folks, if a lawyer says, well, have you looked into your authorizing legislation? The answer could range from authorizing legislation to, no, why would I do that? That's why we have lawyers. So this kind of today, instead of having to search through the bound volumes where the revisor of statutes codified a particular area, it's more intuitive. So I think it would be a good, an easier way for a practitioner to gather some background, maybe even to just phrase the question better, so that a practitioner can actually get the answer they need. So the 2 cents. I think this is the way of the future. I suppose our law is going to continue to be coded in sense because that's just the way we've always done it. But there are all kinds of ways to get to your answer with that and with, well, basically any sort of electronic media. And this is, I think, really helpful and way more intuitive for at least the upcoming generations. And maybe it'll justify or make the law less of an obstacle in people's eyes. Mm-hmm. So that makes sense. I think it's a great idea. Yeah.
Some other questions in the chat. Any questions that folks have on the phone? Which one? There is another question. Was when the optometrist tab was being explained, something that was said made me think that not all statutes and regulations are included, just that were analyzed. I might have misunderstood. Can you clarify? Is this an inclusive look at policy in Nebraska? So this worked with Daryl, and Daryl reached out to a number of attorneys in the state. We academically go through and search to see the scope of law, but being on the ground front lines is always a better way to make sure that we're capturing everything. So I worked to Daryl on this. We worked collaboratively together to make sure this was everything that we thought covered scope of practice. But that's what we're looking for, is if folks start to come in and respond and say, actually, there's something else that you forgot. That's part of the reason why we're doing almost a soft launch, that we're only going to share this with people in Nebraska. So don't open it up to the larger population and have there be more confusion that, oh, this is wrong. You know, we still really see this in the collaborative phase where we're working now, not just with Colleen and Daryl, opening it up to the entire workforce in Nebraska to help us get this right.
Just expand on what Jennifer said by basically saying the same thing. I'm supposed to have to hear things 8 times now to understand them, so it'll be at least number 2. Went into this thing and play with it, and if you see a coded question that you believe is answered incorrectly, the intention is that this would cover everything. But we're covering everything about everything. We're aware that there are going to be things that were overlooked. We originally had the concept under Dr. Schaefer was to bring in kind of a legal fellow who could work more or less full-time at the state level with the Temple folks, and that ended up changing. Basically, what we really determined is if you bring somebody in brand new and cold, that's an unreal expectation on our. So, as Jennifer said, get in, play with it, look at your area of expertise, and if and when you see something that you believe needs correction, let us know. And I will defer to Jennifer whether she wants that information sent directly to the Temple folks, or if you want to route it through Colleen and me here. What's your preference, Jennifer?
We'll actually add an email address. I'll set up a new email address and we'll have it, I will include it when I send the slides, but we'll also add it to the LawAtlas webpage. And that way folks can just click on it and email their comments directly to us. And then obviously I'll share it with you guys, you and Colleen.
Throw something out. This isn't directly responsive to the question, but it's something that I'm kind of interested in. Way of law is codified as the Temple coders have done. This presents what lawyers from the outside have looked at Nebraska law and what they have determined. So I guess my point would be there could be potentially a way of illustrating changes that we could make to our laws that and this actually happens. For instance, if you're I won't use an actual example, but let's say there's a healthcare profession and you think that you would have everything about dental hygienists in a separate little section that deals with dental hygienists, but there's going to be some impact on things that they can do that's contained in the laws about dentists. Basically, the bottom line is we might get some insight into what we could do in the future to clean up our statutes to make it clear to people, demystify it, if you will. But if the Temple coders answer the question in a manner that we think is incorrect, well, the reason for it is because the laws led them to that conclusion. So maybe we need to do something with our laws too. In the meantime, then we can also give feedback and you put a link to the law that deals with the outlier could still be stuck on the dental hygienist page, if you will. I was just picking on dental hygienists out of the cold blue sky. I don't know if there's anything in there that you will quarrel with or not. So think, and if you have suggestions, feedback is solicited.
Off of what Daryl said, like I mentioned earlier, policy surveillance is just observing the immutable characteristics of the law itself. It's in the text of the law. That doesn't include any kind of interpretation. So oftentimes what we would do and what we would find is use Nebraska's website as a secondary resource to cross-check some of our answers and our coding schemes. And oftentimes we would see a disconnect between the requirements were as interpreted by folks in the Department of Public Health and what the law said itself. So oftentimes what you may see, like Daryl just said, there may be things that look different or may not necessarily comport with your understanding of the field of law that is involved in your practice. So like Daryl, this is the lack of interpretive elements will really highlight exactly what we may need to do in the future.
And again, just to sort of give your validity to this, I'm one of those addicts. My background is in health services and policy analysis. That's my PhD. On the team here are lawyers, trained lawyers, and so it's not a matter of me just going through from an academic perspective. These guys are going through and understand everything that they're reading, and they're going through and being able to translate that into the questions and the answers that you see here. So everybody on the team that has been handling the coding of the laws, they are all JDs. I want to mention there are a number of that were coming in with questions about particular content areas. I'm not going to run through all those. What I will say is look at the site here and click through and see there are a couple of suggestions that I see posted up here that are things that we will look into adding. So that would always be the other thing is, you know, there will be new stuff coming, and what we can try to do is have some sort of banner or cover page that shows an update, you know, what are the new areas that have been updated. Daryl, can you introduce yourself again and which department you are in DHHS?
I'm Daryl Klein. I'm an attorney with the Department of Health and Human Services. I actually work in legal services, and I am assigned to support the Public Health Division.
So I think that is it. I don't see any other questions posted up on the chat. I'll do sort of a last call if there are any questions that folks have, but certainly I'm happy to have questions come in. I'm posting up on the screen right now also my email address, my telephone number if folks have questions, or if you want to have a conversation about this, if it's easier to do via phone rather than via email. And what I would say is, you know, to this point, and one of the slides we showed you was the Temple team, the Nebraska team at DHHS. What at this point is we're really relying on all of you to become part of the team in the sense of going through and doing not checks, but just practical use checks and tell us where are places that we could be making improvements. So I sincerely hope that everyone gets in, starts clicking around, playing with this, telling us where we can do a job, you know, really kick the tires and let us know what you think. And as soon as we have local laws posted, what we will probably do is start releasing them in batches. So maybe we'll release 3 topic areas across all the jurisdictions that we've mentioned. That way you can start to access them rather than waiting for the whole lot of them to come out at once. It'll be a continuous feed of new laws that are coming out. So for that, we will keep folks posted via the same listserv where you received the invite. And again, I just want to thank everybody for participating today, taking an hour out of your day. This will be, it was recorded and this will be disseminated for anyone you know who is interested, who would like to take a look. Not the video, but we'll also circulate the slides and the URL again so that everyone gets a chance to take a look. Daryl, any closing thoughts?
Appreciate all the time and work that you guys put in. As Jennifer said at the beginning, like when we, at the very, very outset, when we were just talking about doing it, it was kind of a cool, this will just be awesome. And then we got closer to doing it. I think it's probably how people feel when they're climbing Mount Everest. We looked at it and it's like, oh my God, what were we thinking? And now this is the culmination of it. So I appreciate all the hard work. First off, the idea to do it and getting to do it, and then all the hard work that you guys put in is just amazing.
Well,
so everybody who's looking at this, play with it. If you have suggestions, it's great. But I think Marlene is alleged to have said that it's a craftsman to build a barn, but any jackass can kick it down. So bear in mind the work of the craftsman. So if you have suggestions, keep positive, please, and you guys for all your work.
Well, it's been a pleasure working with you guys as well. It's really been a great collaborative effort.
All said it best, and thanks for all your work.
Great. Well, we look forward to continuing working with you, and I think, you know, as we are continuing to see how this is being used, that survey will be coming out shortly. It's hung up with our institutional review board at the moment, but that will be coming out shortly. So, you know, please, it'll only, I think it's 12 questions in total. And I think what we'll do is towards the end of the grant period, maybe in the fall, actually be able to come out there, to bring our team out there and do a debrief session to sort of see what else we can do to share our findings from that survey, to share the analysis that I did working with the Clean Indoor Air Act, really to get your thoughts and comments about, you know, next steps and other ways that we could be using this. So we really appreciate all your help and look forward to continuing to work with all of you. Take care.